Hi there, it's Exercie here from Integrated Clinical Strength and Conditioning. So, another one of our videos on exercise basics. Today what we're going to talk about, and the call to action for you, is to essentially to think slightly differently about how you select exercise, preferentially, for the development of muscle tissue hypertrophy. So we'll know with certain of our patients that actually we want an improvement in muscular hypertrophy. So for example, the classic example would be, patient who has significant atrophy after a surgical procedure. So they've had a hip replacement, they've had a knee replacement, or they've had an anterior cruciate ligament reconstruction. We would expect to see significant atrophy just by virtue of the fact that actually the iatrogenic, the iatrogenic issues, pain, swelling and such like, is likely to cause inhibition. So from an exercise selection perspective, you will have seen on previous videos, I've talked about exercise selection being the holy grail of rehabilitation. It is, but that was a much more broader overview. Today we're going to go into the specifics, and in particular in relation to muscular hypertrophy. So we all know that muscle architecture, generally speaking, it works in 3 dimensions, as I say. It's not a 2-dimensional or a 1-dimension thing. You only need to look at certain muscles. The deltoid is a case in point. The beautiful architectural arrangement, it works. It has 3 heads and it really works in 3 dimensions, similar to the pectoral muscles. How they twist, spin, and sort of rotate, in order to find their attachment site. So the interesting thing here is a muscle generally works in three dimensions. So there'll be different angles of pull, different planes of motion, which influence essentially, how many fibers are going to be activated. Because the key thing we want to happen is, yes, we want an increase in the cross-sectional area, but also fundamentally we're trying to get that muscle to function and perform better. So whilst most muscles have a common origin and insertion, what many people don't necessarily appreciate is that actually the muscle fibers tend to diverge, around different attachment sites, based upon the pronation angle. So what that really means is, it means that actually what we should be thinking is we should be thinking about exercise selection in 3 dimensions. It's not to say that you can't pick one exercise. Say, for example, someone needs to improve their muscular hypertrophy, after a knee replacement in the quadriceps muscle. It doesn't mean you can't pick one exercise. That's absolutely fine. But we should be thinking in 3 dimensions, which actually means that potentially there's a really good argument actually for picking a few exercises, that essentially train the same muscle, but just train it in slightly different ways. And let me give an example. It's a really nice study, a few years ago was undertaken. And in essence, what it found was that using a variety of exercise routines appeared to produce more uniform muscular hypertrophy, for the quadriceps muscle. So what they essentially did was they took the Smith machine, and they compared that to the lunge, the deadlift, the press, and also the Smith machine. So they take one exercise by itself, and they got essentially the participants to do that, 3 times 10 repetitions over a protracted period. So this is an intervention study, and it was a few weeks as opposed to days. And they compared that essentially to a different group of participants who were mixing, who had essentially a combination of deadlift, lunge, leg press, and also Smith machine. Essentially what they found was, for the Smith machine, there wasn't really a significant increase, in cross-sectional area in vastus medialis and also rectus femoris. Now, I guess the take home for that is, and this is one study, admittedly, but there's other circumstantial evidence really to support the fact that if we take a 3-dimensional approach to our exercise prescription, then actually we may get a more uniform development of muscular hypertrophy, which can't be a bad thing if our goal is to improve cross-sectional area, to reduce atrophy, and to improve the fortunes of that patient. So I guess from that perspective, there is a take-home message, isn't there? The take-home message is not that you need to have 4 or 5 different exercises, okay, for the one muscle group in your patient population. No, okay, but actually, add in some variation, okay, may actually be quite a good thing. So let me give you a very, very practical example. So your patient that has had a knee replacement, okay, it might be a combination of leg extension machine and also leg press. So it might be, 2 sets on the leg extension machine, okay, and then maybe a set on the leg press or 2 sets on the leg press. And that might actually form a part of your 4-set prescription. Because as you can see, actually, there's not a huge amount of variation, okay? And I guess the good thing about this as well, okay, using that sort of protocol, they're very similar in terms of skill level, because there is also an issue as well, in that our job or our goal is to produce high levels of force, okay? If we can produce high levels of force and produce high levels of tension, high levels of tension stimulate adaptations. We know that tension is important. But if there's a high skill element involved in a particular exercise, so for example, a lunge or a split squat with weight, well, that involves a reasonable amount of technical and skill-based ability for our patient. They may not have that ability, which then means that actually you have to use a much lower load because the patient's learning that skill. Well, that is counterintuitive to what it is we're trying to achieve, because we want to drive adaptations. We want the highest amount of tension that we possibly can get. So actually that, say for example on a squat, a back squat, might not be very helpful. But hopefully what you can see, okay, if you're using machine-based exercises or even bodyweight exercises to a certain degree, then actually the goal is, the idea is that you can mix and match, okay, based upon the skill level. So skill development is a caution, and there's no two ways about it. But fundamentally, okay, this is all about principles, okay, and it's about taking principles and applying it to your own practice, okay. So hopefully, I hope that's helpful, okay. You heard it here first. Take home message is exercise selection, okay. We need to think about exercise selection, okay, in 3 dimensions. Okay, one exercise may not be enough, so actually do try to apply this into your own practice and just think in 3 dimensions. Thanks for listening. Join our community. Okay, let's put the rehab back into physio rehabilitation. Bye for now.